So thank you, Liz, for joining me today. So as I explained to you the other day, I posted kind of ridiculous reel on Instagram, just showing how much I hate every single day having to take tamoxifen. And somebody actually on there called it tamoxibollocks, which I totally get.
Yeah, completely.
Because it is, you know, it's, of course, we are all so grateful that this tablet is available to us. Like, we can't ever forget that we are really lucky that it's available to us. But my God, talk about the gift that keeps on giving after your diagnosis.
Oh, it's horrid
to have to keep taking this. Now, is this something do you have to take it as well? Are you on it?
Yes, so I was meant to be on it for 10 years. I started off with Tamoxifen and Zoladex. When I had a local recurrence, they switched me to Letrozole and Zoladex. I then had my ovaries out. But the side effects of the menopause, it's just horrific. And you know you're going to have to go through it at some point, but not 10, 20 years before your time.
No, and that's the thing. So my first question is, if tamoxifen sort of pushes you into the menopause, but you're still in your 30s, does that mean that you are going to be menopausal until you're like in your 50s, when you are naturally supposed to go through it? Like, what's the deal?
Probably. So a natural menopause normally lasts around 5 to 6 years. That's how long women normally suffer with symptoms. And you will be menopausal as long as you're taking those tablets. Although a lot of women do say it gets easier in time. The first 6 months, couple of years are worse. But if you have it when you're 30 and you're on tamoxifen for 10 years and you don't have your ovaries removed, when you stop, your ovaries may kick in when you're 40, and then you may go through your own natural menopause when you get there. So it's a long haul and it's not fun. And we know a lot of women don't take the tablets, but tell the doctors they do because it makes them feel so rotten.
Is that right? Some people just don't.
A lot of patients have treatment breaks. I've thought about stopping them for a couple of months because it just ruined my quality of life, and I didn't get it. As a doctor, I never talked about how you cope with the side effects. It's just take the tablets, off you go. But a lot of women don't take them, but tell the doctors they do because they don't want to upset us. Because they're horrible. And there's no research into what you can do for the side effects. It's this one drug, off you go, goodbye.
Yeah, it is. It really is. Something that came up a lot in the comments was about the brands and whether switching brands makes a difference. So is there evidence to prove, is that right? And if it is, can you then say, I only want this brand?
So I didn't believe this as a doctor because it's the same drug, and how can a tiny chemical made to tweak it make a difference? But patients told me, and I tried, and I did notice a difference with various brands of tamoxifen. I don't understand the science behind it, but some people find, so the Weleda brand is much better for them than another one. You can ask your pharmacist to get it. Sometimes they can't get hold of it. It's out of stock. It's slightly more expensive than the other one. Sometimes you may ask your GP just to say, can you please prescribe this one because it makes a massive difference? And your doctors might not get it. But a lot of women have said, and I found that it can make a difference. So yes, if you're struggling, it's worth asking your pharmacist for a different brand to see if that'll make a difference.
Wow. I mean, that could be quite life-changing for people, because I didn't really think that would be a thing. So, wow, that's really interesting. Now, on to the side effects. What is there anything that we could do, say, for like the hot flushes? I tried acupuncture and that really, really helped me, actually. But is there anything else on the
Yeah, there are. So there's no evidence to show that the alternative remedies like sage and St. John wort oil and Indian primrose oil can help. My oncologist suggested sage extract to help. They're worth trying. Acupuncture and hypnotherapy can help. And often breast care nurses are trained to do them, or there may be a nurse in your local cancer centre. So it's worth asking your breast cancer nurse if they have access to that, because it can help. There are tablets you can try. There are some antidepressants, mainly venlafaxine and citalopram, that can help with the hot flushes. And a tablet called clonidine, Clonidine, is often very good for sweats as well. And I would take both, and it made a massive difference to the number of sweats and night flushes I were getting. As a breast surgeon, I didn't know any of this.
Wow.
But we mentioned them in my book, and I think they're on quite a few websites now. But antidepressants and clonidine can actually help with the side effects, but it means you're taking more tablets.
Yeah.
And it's that, but it can make a difference, because I was having them every hour on the hour. And you don't sleep, which makes you more tired during the day. And
it's that whole circle, isn't it?
Yeah.
And achy joints. Now, you're a fitness fanatic.
Yeah.
Did it affect your joints?
Yes, it did. So the reason is estrogen is a natural lubricant. And when you have tamoxifen, it stops breast cancer cells absorbing estrogen, which means you have less estrogen in your bloodstream. If you're having Zoladex as well, it switches off your ovaries, so there's less estrogen. And that means that your bones, your joints aren't lubricated as much. So if you get a tennis elbow, it may take 6 months to recover compared to a couple of weeks. Everything felt achy and stiff. And that is the natural effect of the menopause. But tamoxifen can make it worse. And weirdly, it's keeping active that can help things lubricated and keep things going. Not to go crazy. You may find that you need to run slower than you used to and recover more, but it is a common side effect, sadly. And it's much worse if you're taking an aromatase inhibitor, because that lowers the amount of estrogen, that stops you making any estrogen at all when you're premenopausal, when you're postmenopausal. And you can get pain, almost osteoporosis in the joints of your hands and your fingers. You can get very sore joints as well.
So I found running, I just couldn't run anymore. My knees were just really, really sore. So I've taken up yoga and cycling, and actually that seems to really work for me. And I think, would I be right in saying it's kind of find the thing that works for you and keep at it? Yeah,
exactly. Although I would say one of the problems of having a menopause is the risk of osteoporosis. So you need some form of bone strengthening, weight bearing activity. And if you're cycling and yoga, that's not a lot of weight bearing. So trying to walk every day as well, just so you are keeping your bones healthy and strong.
Right. Okay. That's good to know. And brain fog. Oh my God.
Yes.
The brain fog. You know, we're still working, a lot of us, and it's embarrassing. The mistakes that I make, it's embarrassing. And what can you do for brain fog?
It's really hard. It's a bit like chemo fog. And at first I thought it was still chemo brain carrying on, but it's not. And I'll still ask my husband to pass an orange when I'm either remote control. He has no idea what I mean. I can't remember the names of words. And whereas before I could have 5 things going on in my head, now if I don't write them down, I'm like an idiot. Exercise can help. And mindfulness techniques, kind of CBT, various exercises just to try and calm you down. So I've just read a brilliant book by a friend of mine. She's a doctor with breast cancer, and this is in reverse. But she's called Anise Mukherjee. It's the complete guide to menopause. And she's got a chapter on brain fog and the forgetfulness and things to help with that. But it's techniques like mindfulness, CBT to try and help calm you down, exercise, getting rid of stress, because the more you've got on in your life, the worse it's going to be. If you're tired, if you're exhausted, and the hot flushes and night sweats make it worse. It's just terrific.
Everything anticipates the next thing, doesn't it?
It's also learning you can't work like you used to. You might need to tell your boss, it's going to take me another 15 minutes to do this task. I need to write things down. I can't remember 3 things at once. I'm not being stupid, it's the menopause. And trying to retrain yourself and your team how you work.
Yeah.
But so it's really hard.
That's really interesting. And something that I've learned actually during lockdown is I've really listened to my body, and I've realised that meetings in the afternoon, sort of around 2, 3, 4 o'clock, pointless. There is no point talking to me at that point. Talk to me first in the morning, or even weirdly around 5 o'clock I get a boost back in then. But I now sort of structure my day around my mental
your thinking time. But it's
what?
a really good way to do. You just make use, when you're more awake, and you kind of use the afternoon time for kind of menial tasks, or just going through emails that you don't really need to think too much.
Absolutely. Now, the other thing is, I know we're rattling through this, but weight gain.
Yes. So I put on 10% of my body weight.
Did you?
When I finished treatment. There's not much. I was 58 kilos when I started chemotherapy, which isn't much because I'm 5'8", but I was 65 kilos when I finished about a year after treatment. You wouldn't see it to notice me, but that's still a 10% body weight gain. And I was a fit cyclist. We know that the menopause slows your metabolism down. It's what happens naturally to a lot of, we see your mums, they kind of get a mummy tummy, they kind of change shape. It's what happens naturally, but you don't want it in your 30s and 40s. And it is much harder to lose the weight. Tamoxifen itself doesn't cause it, but it's the menopause, and you can stop it, but it is bloody hard work. Basically, you need to exercise, and it's weight-bearing exercise. It's weightlifting, squats and lunges at home, press-ups against the kitchen counter, as well as aerobics, but it's changing your diet. Because when you're working from home, I like to eat carbs. I'll have cereal for breakfast, I'll have toast for lunch, and the biscuits and the crisps and the snacks. You need to have a lot of protein.
Right.
I managed to lose the weight and get a load of muscle by training really hard, but it was my diet. And I was having 30 to 40 grams of protein every meal.
Wow.
And that's a lot.
Yeah.
I was having a protein shake just to get protein in with breakfast, because I don't like eating eggs or steak in the morning. And not having as many carbs at night, because your metabolism slows down. You can lose the weight. And actually, we know that if you are obese, it increases the risk of your cancer coming back.
Yeah.
Because you make estrogen in your fat after the menopause, and the more fat you have, the more estrogen you make. But it's really hard, and no one wants to work hard after breast cancer, because you've had breast cancer.
Yeah.
It's that double-edged sword. But I don't want you to think, oh, it's breast cancer making me put on the weight, I'm never going to change it. You can, and you really should do what you can. But it's having a lot more protein in your diet, and cutting out the carbs at night that can help. But it's hard.
It really is. What about alcohol?
It's fine, in moderation.
Yeah.
We know that binge drinking alcohol in postmenopausal women can greatly increase the risk of getting breast cancer, but drinking alcohol is not going to make it come back. So a glass of wine here or there won't do you any harm at all. Just don't go to excess. And the reason is alcohol is converted to fat, and fat produces estrogen.
Yeah.
It's an 80-20.
And then again, you have that cycle of, if you have too much alcohol, you don't sleep as well. If you don't sleep as well, you don't.
Oh God, I can't drink.
It's like,
yeah, it's never worth it. One glass of bubbly to celebrate a birthday, and I had night sweats for like 3 days. It's just not worth it. So I have to remind my husband, tell me don't drink.
Yeah. Yeah. But we need these things in our life.
We do. I know.
Now,
you accept you'll be a sweaty mess.
Exactly. Something else that came up a lot is, why are some people on Zoladex or Tamoxifen or Letrozole?
Letrozole, yeah. Okay.
What's the thinking around who's on what?
Yeah, so I'll start with most small low-grade breast cancers in premenopausal women are treated with tamoxifen. It's a very good drug. We give it to postmenopausal women. It's often given to people with metastatic breast cancer. It works by stopping breast cancer cells attaching to estrogen. And if they don't have estrogen and they're ER positive, they die. We now know lots of studies have shown that if you have a medium or a high risk of your cancer coming back, and that's generally everyone who needs a chemo, so larger tumours, high grade, lymph node positive, young age, your risk of recurrence is higher. So we give you tamoxifen for 10 years instead of 5. Right. There have been studies that have shown that in those women with a medium to high risk of recurrence, adding in ovarian suppression can increase the overall survival benefit. So an extra 3 or 4 in 100 women will still be alive if we suppress the ovaries as well. And it's all about reducing the amount of total estrogen in your body. So tamoxifen works by stopping breast cancer cells getting estrogen, and your ovaries are still churning it out, but the breast cancer cells can't get it. So there's still a little bit of estrogen in your blood that will keep your bones strong. Yeah. Zoladex switches your ovaries off. So you're making estrogen completely, it switches them off. That's why we give it during chemo, to preserve them for fertility.
Right.
So Zoladex is basically making you postmenopausal.
Wow. Yeah.
And then you have the option of so when you're postmenopausal, you still make estrogen in your fat. And that estrogen can go to breast cancer cells and make them grow. Okay. So we can either then give tamoxifen, which stops the breast cancer cell recognizing to estrogen, or we can give letrozole, which stops the fat making the estrogen in the first place.
Right. Okay.
And there are so many different trials, and different surgeons will have different preferences based on what they've seen and what they're used to. But basically, if you've had chemotherapy, you're going to be given 10 years of endocrine treatment. And that will probably be tamoxifen and Zoladex, or letrozole and Zoladex. However, Zoladex makes the menopausal symptoms much worse.
Mm.
And I had it for a year and a half and I struggled. I hated the injections. And I went back to my oncologist and she said, well, actually, the benefit is quite small, so I'm happy for you to stop it. And it's worth going back and having discussions. If you may be struggling on tamoxifen, but you may find things easier on letrozole, and you can switch between brands if you are struggling. But does that kind of make sense?
Yeah.
It's lowering the estrogen in the body. There's some women may not be given tamoxifen at all because tamoxifen can cause blood clots.
Yeah.
Clots in the leg, clots in the lung, and strokes. And if you've got a history of high blood pressure, or you've had clots in the past, or you've got liver disease, it might not be safe to give you tamoxifen. So you may go straight to letrozole and Zoladex if you're premenopausal.
And what about having your ovaries removed? That's sometimes an option that's put on the table.
Yeah. I was meant to have Zoladex for another 5 years when my cancer came back, and I wasn't completely menopausal after chemo. And I hate the injections. They look at me, there's not much in my tummy. Oh God, it's you again. I didn't like the needle. It's big, it's sore. And I opted to have my ovaries out. I knew I wasn't going to have children again. And it was the best thing I did. It's not fun in the first month because it's an immediate surgical menopause. But I feel much better after having it done. And that is an option, but it's irreversible. You will never have children again.
But if you're out of the child zone and tossing up Zoladex over ovary removal, is menopausal impact the same with
yes? Yeah.
So you can't, but that's irreversible, having your ovaries, but you can stop taking the Zoladex. It's
I know, it's horrid. And you know you're going to have to go through it at some point, but it's just, I think it's really hard when you're young because you've also got the gynae side of things, the loss of libido, the vaginal dryness, all that kind of stuff. It's
something else, isn't it? And what are your thoughts on HRT if you're hormone receptive, if your cancer is hormone receptive, but you're menopausal?
So the party line, and the line I always believed, was that you don't give HRT if you've had breast cancer with an ER positive cancer, because estrogen and progesterone can cause it. And I would always be really, really, really wary. However, there are some women who are suicidal with their menopausal symptoms, and there are some doctors who would actually prescribe it. And it's for each woman to accept her own risk factors and say, if my breast cancer comes back, it could be because of the HRT. I don't want my family to blame me or hate me. It's that balance. Yeah. How are you going to feel if it comes back? But I'm not the one living with horrific suicidal menopausal symptoms. Yeah. And there are some doctors and GPs that will prescribe a low dose for you. It's not recommended. It goes against all the guidelines, but there's never going to be a big trial giving HRT to a load of women with breast cancer, seeing what happens. And it's also worth remembering that it comes back in a third of women with all the treatment. And actually it comes back more in the older women. We think it's the young women because they're the ones in social media, but actually most women with metastatic cancer are in their 70s, 80s, 90s. Because most women with breast cancer are in their 70s, 80s and 90s. Yeah. But you don't hear about those in the press.
No, you don't. So what I wanted just to quickly do, if it was all right, is just I will have a quick look at the questions that a couple of people had mentioned. So honestly, there's so many. Taking tamoxifen, would you recommend more taking it in the morning or at night?
I took mine at night. I think it made a difference to me. But everybody's different. And that was initially in the first couple of weeks you take it, you'll often get quite sick, nausea, headaches, migraines. And I took that at night. So the nausea came on at night when I was asleep rather than the morning. From a cancer point of view, it makes no difference at all, but it's worthwhile experimenting and seeing if it makes a difference to the side effects.
That's good to know. So I had changed it from morning to evening. So I take mine now before bed because I was feeling a lot of fatigue during the day, and it did seem to help taking it at night. So that was good. Eyesight.
Yes.
Can it affect your eyesight?
Yes. Tamoxifen, I think, can cause cataracts. It's a very, very low risk. So I started having eye tests every year rather than every 2 or 3 years. I think if you do wear glasses or you haven't had an eyesight for a while, it's worth having an annual test.
Right. Okay.
When you switch to Letrozole, it doesn't have the same effect, but it is worth doing that. It will make your hair thin. Yeah. That's the menopause. Sadly, my hair is a lot thinner than it used to be, and there's nothing you can do about that. It's just the natural aging in the body. It will make your skin look dry and wrinkly because estrogen is a natural lubricant. So you'll find that your legs look like snake skin, and and the crow's feet. And
I've never had that before. I hate it.
Yeah. Don't zoom in too close.
Yeah.
The joys of the menopause.
I've been taking tamoxifen due to various side effects. I'd like to know what my recurrence odds are on tamoxifen versus ovarian suppression, which my oncologist is now suggesting.
Okay, so there have been some studies that have shown that tamoxifen has the same results as ovarian suppression. You don't need both together, but ovarian suppression will probably have the same side effects, and probably worse side effects than tamoxifen, because tamoxifen stops estrogen attaching to breast cancer cells, and they are the ones that mainly absorb estrogen into your body. But you still have some estrogen because your ovaries are producing it, which will go to the bones and the joints. If you have ovarian suppression, you're not producing estrogen at all.
Right.
And you're not going to make a lot in the fat. So the side effects are much worse.
With you, yeah.
But it's worth asking your doctor if you could have a treatment break. Could you have a couple of months off? Because we know the effects of tamoxifen will often last another 2 or 3 years after you finish taking it.
Is that right?
So actually having a treatment holiday every couple of months, a couple of months a year might be something you could do. And I'd rather a patient did that than not take it at all.
Yeah, yeah. Tamoxifen tends to be advised to take it for 10 years. It used to be 5 years.
Yes. So
be worried.
No, there were some studies done, the ATOM and the ATLAS trial, that looked into extending. Initially, it was started with postmenopausal women who were taking anastrozole and letrozole, and did we give them 5 years or 7 years, and did we add in tamoxifen? But they looked at it in premenopausal women, and they found that in women who have a medium to a high risk of recurrence, and that's most young women with breast cancers who tend to get larger cancers, lymph node positive, their risk of recurrence is higher. By giving tamoxifen for another 5 years, it improves the survival benefit. So more women will survive if they're on 10 years of tamoxifen therapy.
Right.
But it's also remembering that tamoxifen does have serious side effects. It can cause endometrial cancer. It can cause strokes. It can cause clots. You do need to be aware if you develop high blood pressure, all those kind of things. It's not a completely safe drug.
Right. Oh, God. Honestly, the tamoxifen needs a book in itself, doesn't it?
I know. But it's all we have at the moment, and it does work.
I'm
trying to think what else. I think another way, if you're struggling, is there's a great website called NHS Predict, which most doctors use to work out what your benefit of taking tamoxifen is. And you can put your numbers into there, and it will tell you your risk of recurrence after treatment and after 5 years, and it will tell you what the benefit of hormone therapy is. And if it's only 1 or 2%, that means that only 1 or 2 women in 100 will be alive because of tamoxifen therapy. It's very small, and that may be a reason to say, can I stop taking it? I've had 2 or 3 years. I'd ask everyone to take it for a couple of years to see if the side effects do improve, but it's worth just asking, is it really worth it?
If you took a break from it, a holiday for a couple of months, I know that you're not, you need to check.
I've done it myself.
Yeah. Do you notice the difference quite quickly?
Yes. After about a week or two, it takes 2 or 3 weeks to get out of the system. and you do notice it. And then when you go back on it again, it's like, oh God, you think you're fine for a couple of weeks, then no, here we go again.
And
so
then
it's not fun.
Is it then harder when you go back onto it because you've had that break? Is it like, oh?
I think it felt more familiar because I knew what was coming and I was prepared for it. But having had about a month of relatively nice sleeping through the night, it's like, oh God, here we go again, strip off, separate duvets.
All of that.
Is it actually worth it? Because I know I have to go back onto it. But again, if you're struggling, it's something you can ask your doctor or your GP about.
Marina coil, please can I ask about having the Marina coil fitted after ER positive breast cancer?
I had one and I kept it in. Right. It's a very good contraceptive. It releases a very low dose of estrogen topically into the uterus. And I think it's a very safe contraception because tamoxifen is a teratogen. So that means if you get pregnant, you will get abnormalities in the fetus. So you're not meant to get pregnant whilst you're taking tamoxifen. You need to use contraception. And the Mirena is a fantastic coil to use. It can last for 5 years. Most oncologists and gynecologists should be happy to put it in.
And but you don't have that now because you don't need it.
No, I had my ovaries out when my cancer came back. So because I had the Mirena taken out at the same time because I didn't have ovaries, so I physically couldn't get pregnant.
Right, I'm with you. Okay.
It's also like you can have Vagifen, you can have vaginal estrogen, which is safe to improve the lubrication. Because as a cyclist, I suddenly found I was getting bleeding rips in my labia. And I wear cushion pads. I was used to cycling 100 miles, and suddenly it's like, oh my God, it's like a paper cut down there. But Vagifen to help lubricate the skin and internally made a massive difference. And it is safe. Wow. You are allowed to have it. It's a tiny amount of estrogen absorbed locally. And again, when a third of cancers come back despite full treatment, I have the right to say a tiny amount of vaginal estrogen to improve my quality of life is much better for me than the chance that that's going to be the thing that makes my cancer come back. So there are things you can do. It's just going to your GP and asking for them.
Are there any other supplements that you think that could be taken to help with joint pain? Things like cod liver oil, that sort of thing?
I'm not aware of the evidence. I think there's no harm in trying it. So a lot of the arthritic supplements like chondroitin and glucosamine, you can try taking them. I think basically a good, healthy, balanced diet with a lot of vitamins and minerals, the kind of fish, the omega-3 oils. I think if you eat a healthy, round, well-balanced diet, you shouldn't need to take supplements. But if you're basically living off carbs, beige food like I was for a couple of months, then you may need kind of vitamin supplements.
Okay.
But I wouldn't spend 60, 70 pounds on supplements.
No. No, actually, they can be really expensive, can't they?
Cost a fortune, and you should be able to get them from your diet normally.
So taking the either Zoladex, Tamoxifen, Letrozole, do they increase your chance of womb cancer? Or
Tamoxifen does. So tamoxifen does increase your risk of endometrial cancer. It's small. I think it's less than 1%, but it can happen.
Right.
And that's why a lot of women who are on tamoxifen for 10 years, who have their ovaries out, asked to have a hysterectomy as well to reduce the risk of endometrial cancer. But it's a much bigger operation. I didn't. Right. But so if you have PV bleeding, vaginal spotting, irregular bleeding that's not normal for you, you must go and get it checked out.
Okay. I think we are tamoxifen out.
I think we are. It's bollocks. It's a horrible tablet. It really is. And I wish every day I didn't have to take it, Letrozole.
But do you know what it's great is to hear people like yourself talking about it that just has been through it.
Yeah.
And you also know all the textbook around it as well, and why, all the reasons why we should be taking it. But it's just so refreshing to hear you say it's bollocks, because it is.
It's horrid.
Yeah. But it's great, that we are able to take this, and the positives, of course, outweigh the negatives.
Yeah.
But yeah, having to take that every single day is a bit of a mind mess,
I know. It's the daily reminder. And again, you knew you'd have to go through the menopause at some point, but you didn't want to do it at 35 or 40.
No, did not sign up for that. You know, you think it's bad enough, you know, going through chemo and losing your boob and losing your hair and this, that, and the other, everything else, and then it's the menopause, and it's like, wow.
I know. Now I know why my mum went food shopping every day to go into the freezer aisle. Let me just cool down.
Oh, bless her. Thank you so much for your time.
No, you're welcome, Helen.
Appreciate it. And you've got a new book out, haven't you?
I do. I've just written my own medical memoir about life as a female surgeon in a man's world. So watch this space.
Yeah, definitely watch this space. And actually, you have a book out already that's on the shelves, which is the best.
Yeah, this
guide.
I wrote this with Trish Greenhouse. She's the woman behind all the COVID mask stuff. We both had breast cancer, and this answers every question that we couldn't find on the internet, because doctors tell you not to Google it. It's the first thing I did. So it tells you how to cope with everything. It's like a handbook. So I thoroughly recommend it, and I'll make sure that I put a link up to it. Brilliant. Thanks, Helen. Thank you so much for your time. I massively appreciate it. You're welcome.